On April 4th, in 1802, Dorothea Dix was born in Hampton, Maine. Having a mother with bad mental health and an alcoholic of a father, she grew up in an abusive household and was forced to take care of herself and her two little brothers. She never really had a childhood because of this. Although her father was an alcoholic, he taught her how to read and write, which helped her get ahead in school and have a passion for teaching others, like her little brothers. With the help of her wealthy family, she was able to start a small private school for little girls, which she taught at from age 15 to 18. She closed it down when she heard her second cousin was in love with her, and she fled to Boston and reluctantly agreed to his proposal when he followed her there. In Boston, she started a school with the help of her grandmother that taught both poor girls and rich girls. At this point in time, she knew that she should not be married, so she returned the ring, and from that point in time, she knew that the rest of her life would be dedicated to teaching. From 1822 to 1836, she began writing books for children as well as teaching her two classes. In 1836, she also started to take care of her sick grandmother, and all of these things combined made her completely break down, and she had what is now called tuberculosis. This lasted until 1841, and by then she returned to Boston with better health. Her second career was started from when she went into East Cambridge jail to teach Sunday school to the women inmates. Inside the jail, she noticed the cells were unheated, unfurnished, and dirty. She also found that there were prostitutes, drunks, criminals, and the mentally ill all living together in these conditions. Seeing these disturbing images, Dorothea's life was from then on changed. She immediately went all around Massachusetts, investigating all the jails, taking careful notes, and found the data she needed to bring to the Massachusetts legislature. She was very influential to the legislature since she had connections with people in it, and soon after debates about it, the legislature decided to support and fund Dorothea. They started by funding the expansion of Worcester Hospital. Dorothea's views on these issues were very different and radical at the time, since the popular thought was that the insane were incurable, and it didn't matter what conditions they lived in. But Dorothea showed everyone that even if the conditions were made a little better for these patients, some of their mental illness could be more stable. She certainly wasn't a professional on their mental disorders, but she knew it couldn't hurt if they were in a nicer facility. Even though she was in bad health, Dorothea was able to get around to every state east of the Mississippi, and for each one created a document that would be able to be presented to the state's legislature. As a result, she helped the founding of 32 mental hospitals, 15 schools for the feeble-minded, 1 school for the blind, and some training facilities for nurses. She established libraries and prisons and mental hospitals as well. Her work inspired the building of even more institutions with better conditions later on. In 1848, she sent a document to the United States Congress asking that 5 million acres be set aside especially for the mentally ill. It was passed by both houses in 1854, but was vetoed by President Franklin Pierce. She soon gave up on this idea and traveled to Europe for rest, but quickly ended up inspecting the facilities there, and within 2 years she traveled to England, Scotland, France, Austria, Italy, Greece, Turkey, Russia, Sweden, Denmark, Holland, Belgium, and Germany, and also within these 2 years she bettered the institutions there as well. When she returned to the United States, she ended up becoming the superintendent of Union Army nurses during the Civil War. She wasn't as effective in this field of work, but she did serve all throughout the war. With her health declining, Dorothea Dix died on July 17, 1887, ending a very unique and influential career of a very unique and influential woman.